Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The topic today in Neighborhood Health Watch is screening for colon cancer. March is Colon Cancer Screening Month, and it's a great time to talk about cancer screening options. What we do know about the disease from doctors is that more than 100,000 new cases are diagnosed each year. 50,000 people die from colon cancer each year, and it's important to note the death rate is dropping. Doctors say the main reason is because of screening programs. Dr. Peter Miller with Henrico Doctors Hospital is here to get us informed. Welcome and thank you, Dr. Miller. Let's start out with why should screenings become a regular part of a person's health? What is it that you see, doctors see, when you do these tests?
Well, as you mentioned, colon cancer is a very common disease, and one of the best weapons we have to combat the disease is to catch the cancer before it becomes a cancer. And what we know is that some tissues in the form of polyps or precancerous tissue can turn into a colon cancer over time. So by screening, we hope to eradicate cancer before it forms. And also, when we do screening, we catch colon cancers early in the process, and therefore they're going to be more treatable and people are going to have a better outcome.
Dr. Miller, at what age or circumstance should a person think about having the screening?
So the bottom line is really that everybody over age 50 needs to be screened for colon cancer. There are special circumstances for people at higher risk. For example, if your mother was diagnosed with colon cancer at age 55, typically recommend that you would get a screening colonoscopy at age 45. And so there are other factors that increase your risk of colon cancer, including diseases like Crohn's disease or ulcerative colitis. Those people are going to have a screening colonoscopy at a younger age.
And which types of screening actually detect the polyps? There are different screenings for colon cancer. Which types will do that?
Correct. Most doctors would agree that the gold standard is to have a colonoscopy performed, and that's, we insert a scope into the patient and look at the inside of their entire colon, looking for both polyps or a possible cancer present. The other tests that are available are stool tests that look for either blood in the stool or cancer cells in the stool. And the advantage of those tests are they're less invasive, but also they don't catch the polyps as well as colonoscopies do.
And talk about, if you could, preparing for the colonoscopy and what actually happens when you have it.
Sure, and the colonoscopy really gets a bad rep, and people are scared to undergo it because they think it's going to be uncomfortable, but most people find that the process is actually a fairly comfortable process. The day before, you go to the pharmacy and pick up your prep, which is used to clean out your colon, and you're going to be taking a clear liquid diet, no solid foods, and you're going to be taking a lot of liquids in to keep from getting dehydrated.
Right. And quickly, is the cost covered under insurance?
Yes.
It is.
Usually cost is covered 100% of the time.
Excellent. Dr. Miller, we feel so much informed. Thank you very much for joining us.
Thank you.